my name is Akanksha Sriram, and I will be presenting on the automated diagnoses of neurodegenerative diseases. But before I begin, I'd like you all to get to know me a little better. I am a rising junior at Raleigh Charter High School, which is located in Raleigh, North Carolina. Some of the activities that I'm involved in include Science Olympiad, my school's student government, in which I'm the student body treasurer, my town's youth council, on which I'm a board member, my school's digital citizenship club, in which I'm the co-president this year, MIT Future Maker program of 2025, and my school's tennis team. Additionally, I am a research intern at the University of North Carolina at Chapel Hill, thanks to the UNC Primes program. Passionate about public health, biomedical sciences, and mathematics, I aspire to create mechanisms through which individuals worldwide can access quality services at reasonable costs and meet their basic needs, while also striving to create positive change in my local community. But before we begin, what are neurodegenerative diseases? Well, according to the Barrow Neurological Institute, neurodegenerative diseases are conditions that affect the nerve cells or neurons in the brain and spinal cord. They are incurable, often debilitating conditions that result in the progressive deterioration and death of neurons. This causes problems with movement or mental functioning. Examples of neurodegenerative diseases include Alzheimer's disease, Parkinson's disease, and multiple sclerosis. While there is no cure for these diseases, treatments can help manage symptoms, improve quality of life, and potentially slow down the progression of the disease. It is said that the brain is one's strongest weapon. From motor skill development to the creation of bright ideas, each and every individual has a brain that is capable of incredible things. So, shouldn't it be one of our top priorities to protect the brains of ourselves and the human population to the best of our ability? Recent studies have shown strong correlations between socioeconomic position and the mortality of neurodegenerative diseases. This is due to factors such as poor access to neurologists, healthcare, and diagnosis, as well as higher rates of comorbidities such as obesity, diabetes, and depression. Additionally, evolving technologies can cause changes in lifestyle which increases susceptibility. One prominent example of this is decrease in vitamin D exposure from going outside, which can be linked to increase in technology uses. And also, groups of people that previously had very low incidence rates are now experiencing higher rates than ever before. For example, within the US, Black individuals, particularly women, are recognized to have higher incidence rates by nearly 2 to 3 times as much as before. These infographics show the number of people worldwide that are affected by various neurodegenerative diseases as of 2019. That number has increased now. According to the World Health Organization, more than 3 billion people worldwide currently live with a neurological condition. So, what can we do? Well, currently, as a research intern at UNC School of Medicine, we have focused on implementing a branch of AI known as computer vision to increase the efficiency of diagnoses. Focusing primarily on multiple sclerosis, we are investigating the correlation between the volume of a region in your brain known as the choroid plexus and the development of multiple sclerosis. By implementing software such as FreeSurfer, we strive to create a mechanism by which automated choroid plexus segmentation can be performed and used as a method of diagnosis for this neurodegenerative disorder. Well, essentially, from all that I've said, what I want you to take away is we now live in a world of AI, whether we like it or not. Let's use it to our advantage, is what I say, to help others. By using AI to speed up diagnoses, we can increase treatment speeds. And in the future, we as a global community should focus on reducing the risk of comorbidities that augment the progression of neurological disorders, enhancing health literacy, or essentially educating the public on neurodegenerative disease prevention, treatment options, and the role of AI in diagnosis, and most importantly, diversifying research and clinical trials to ensure that no race, ethnicity, or group of people are left out or overlooked in clinical neuroscience research. Now, you may be wondering, what can I do? Well, the most important thing that you can do is to ensure that yourself and those around you are leading a healthy lifestyle in order to optimize your brain health. Additionally, you can support research and policy and combat stigma about these disorders and the use of AI and spread awareness within your community. These are the references that I used to create this presentation. And I'd like to thank the directors and faculty of UNC Primes, which include Malcolm Bailey, Professor Wu, Professor Monroe, and Professor Jules, as well as the Johns Hopkins Global Health Leaders Conference, for giving me the opportunity to present on this global health topic. And lastly, I'd like to thank my mother, who has been my #1 supporter since day one, for always supporting my passions and interests. And most importantly, I'd like to thank all of you for listening to this presentation. Thank you all so much for your time. And feel free to reach out to me if you have any questions, comments, or concerns. Once again, my name is Akanksha Sriram, and my email and my LinkedIn have been provided for your reference. Thank you all so much once again for listening, and I hope you all have a very nice day.